Public Health Informatics Institute, we are always looking for jurisdictions who are meeting data modernization initiative needs in effective and unique ways. And one of those is the Department of Health in the state of Alaska. And as we all know, the state of Alaska is quite unique in the fact that it is very large, but has a small population. And so what that meant for COVID-19 was that at first they were really able to contain the virus, but then over time it spread to more and more remote places. And that sheer volume of data made them realize that they needed to be strategic with their thinking of how they plan their public health infrastructure moving forward. To help them gather perceptions and pain points from across the agency, they conducted surveys and interviews, and the Chief Health Informatics Officer at the time hosted a data summit, which allowed for her to bring in perspectives to allow for staff at all levels to share their experiences. This rich amount of data allowed for them to think about informatics from the enterprise level.
To think about what are the requirements for the CDC grant. So let's address those and then think about building capacity and doing the things like creating a division strategy, a department strategy, and what this might look like for an organization to have not just public health informatics, but informatics broadly, and use this as a catalyst to modernize not just public health systems as they're all so intertwined, but use it as an opportunity to begin those conversations department-wide to support all the things that we want to do in an enterprise and collaborative and coordinated way.
Thanks to all the data they collected, they were able to identify the existing state, the data they have, as well as the gaps that really allowed for them to identify different projects that were happening across the agency and where there were opportunities for connection and collaboration.
You know, not having a plan, it's hard to align on the what. Like, what are we doing? Why are we doing this? And gain consensus and buy-in. So without a plan, it's hard to educate, bring on all sorts of interested parties inside the four walls of government and then outside those four walls. So I think that's probably the biggest impact, is agreeing on the what, and then they use that to take to private sector, to other stakeholders, and work through the how.
I also think there's been an internal benefit into helping folks across DPH see themselves in data modernization. A lot of times the question is like, what is this? What does this mean for me? And already with the plan, we're kind of, these are the opportunities, these are the challenges, these are the goals. And so I think that that's been a really big benefit, is the breaking it down into digestible pieces for our internal staff to really kind of rally and say, yes, this is important. And then that enables them to do the work that they do each and every day, serving Alaskans.
Having a data strategy and having an approach to how and when information is shared and what systems are in place is really, really helpful, because we get out of the individual issues and fires into more of a coordinated and strategic approach. Getting information to people is first priority. Second is making sure that it's more sustainable and coordinated. And then the last piece is that our federal partners get the information that they need to steer the country.
Data will continue to evolve, our tools will continue to evolve, our people and the skills that they have will continue to evolve. And so trying to move more into a mindset of this is something we're always going to be doing. We need the investment right now for public health to really catch up with where a lot of the healthcare space is, but then also to keep moving forward. This is not just a one-time project, but that it's really an approach and a commitment to having the data systems, the people, the connections, the relationships, the management in order to serve communities across Alaska, across the US.